what is our doctor-to-patient ratio, and how does it compare in terms of the WHO recommendation of 1 to 1,000 patients?
Unfortunately, I don't have the figure right here with me. We don't even look at it because we know we are very, very far from reaching it. I've already informed you, there are not many doctors who reach that ratio. It's quite high.
Let me try help the minister here. As of 2021, South Africa had approximately 8.09 medical doctors per 10,000 population, equating to about 0.81 doctors per 1,000 people. This figure falls short of the World Health Organization's WHO recommended doctor-to-patient ratio of 1:1,000. Back in 2022, the doctor-to-patient ratio was reported to be 1.398, indicating a significant shortage of medical professionals in the country. According to a report by Daily Maverick, this shortage is further highlighted by the fact that, in 2019, South Africa had 0.79 doctors per 1,000 patients, a figure that was already low compared to countries like the United Kingdom, 3.03, India, 0.93, Brazil, 2.32, and Mexico, 2.44. Additionally, there is a notable disparity between the public and private healthcare sectors. In 2015, the public sector had a people-to-doctor ratio of 4,024 to 1, while the private sector had a ratio of 330 to 1. This imbalance underscores the challenges faced by the public healthcare system in providing adequate medical care to the majority of the population. The shortage of medical professionals in South Africa is a pressing issue that requires urgent attention to ensure equitable access to healthcare services across the country.
You can imagine, that South Africa is having a serious problem when it comes to the number of doctors per population. We're sitting at 0.3 per thousand. Way less than what is recommended by the World Health Organization.
How big is this issue of unemployed doctors, not only in the Eastern Cape, but in South Africa?
In our country, I'm sure you are aware, even in September, the Minister of Finance mentioned it. We, even in February, we have got very serious austerity measures, very crippling budget cuts that affect not only our capacity to hire doctors, but to perform quite a large number of functions. So yes, we do agree with the grievances of doctors, but in the final analysis, you cannot give a job for which you don't have the means to pay such people, and that's exactly the situation in which we are.
We are facing a crisis as a country. We are now having over 1,800 junior doctors who are currently unemployed, nationwide. And this is despite them completing their community service. And like you said, the Eastern Cape, as you know, had recent decisions, that really that is disheartening.
In medicine, you study for 6 years. When you complete, you can't do anything. You can't work. You can't go into private practice. You can't open your practice. You can't do anything unless you do internship, which is for 2 years. It is statutory, means whether the government likes it or not, the treasury will have to stop something somewhere to hire an intern because it's statutory. And now that's what I remember at that time. There were more than 800 doctors or interns which were not placed, and they were discussing with treasury to place them. After you finish internship, you go and do community service, which is also statutory. You are forced by law. And so the state is forced to hire you, whether it likes it or not. After that, you are a free person. You are a fully-fledged doctor. You can go anywhere. If the state advertises post, you can apply. If the post is in a private sector, you can apply. If you want to open your own private practice, you can do so. If you want to go and work elsewhere, you can do anything. Now I hear words like absorption. After community service, there's nothing like absorption. You apply for a job like any other job seeker, like any other graduate who is employed somewhere.
Circular 31 of 2024, where they were saying that they are not going to be able to absorb those community service doctors who have completed community service.
I personally am a doctor. I would like people, and I'm a minister too, I would like people to get employed, but I don't want to give you an impression that there's a special deal for some people because they are doctors. We also have unemployed nurses, unemployed social workers, all of them, unfortunately, because of austerity measures and budgetary constraints.
We see a government that is unable to plan. You will notice that we've been sending students to Cuba, sending students to Russia and all these things. But what has become obvious is that this government cannot plan. And if you ask me, this is a government that is not caring for its population, but also for its youth. How do you allow 1,800 doctors to be unemployed in a country where there's a shortage, in a country where there's poor service delivery, because of the shortages that we see on the ground? Because this does not only affect doctors, it affects other healthcare professionals as well. And you can imagine what is going to be happening. You know, these doctors are going to go away, go to other countries, be taken by Canada, by New Zealand, by UK, by all these other countries. And it means this government is using taxpayers' money, in fact, wasting taxpayers' money to train for other countries instead of training for their own country. We see the wastage that we see. And this is the kind of attitude that we see from the minister. You know, a minister that cannot listen, you know, to what the youth is saying. The young doctors, highly skilled, highly educated. You cannot allow that skill to be washed down the drain without absorbing them into the system.
And one wonders what it means then for the ones that are looking at this and are still within the system and trying to finish their qualifications. They're probably worried that this is going to have a ripple effect even when they come back into the system to say, we've qualified.
It's actually demoralizing if you look at it, because you can't be a student and be, you know, having that morale to push your studies. If you can actually see that your colleagues are sitting at home and government is just looking at them and giving them petty excuses, you know, instead of creating opportunities for the young ones. I mean, this country, we know, has a serious problems of unemployment, you know, but we have employment, we've got vacancies in the public sector. But what you have seen is that there's been mismanagement of funds, there's been corruption, there's been all these things that has impacted negatively on the numbers of healthcare professionals that we see in the country. And that's a problem that is going to be perpetuated, especially if we don't rectify the problem that we have.